Adrenal cancer is an oncological disease. Look at this picture, shows that adrenal gland and cancerous tissues. CT findings, look at this. And MRI findings. Look at this. Detail going on. Introduction. Adrenal cancer, though rare, is a potentially life-threatening condition originating in the adrenal glands, two small organs located on top of the kidney. These glands produce vital hormones that regulate functions like metabolism, blood pressure, and stress response. While most adrenal tumors are benign, non-cancerous, some can be malignant and may require aggressive treatment. A definition. Adrenal cancer, also known as adrenal cortical carcinoma (ACC), is a malignancy arising in the adrenal cortex, the outer layer of the adrenal glands. It can lead to abnormal hormone production or may present as a large mass without hormonal symptoms. Types. A. Benign tumors. 1. Adenomas, non-cancerous and common. 2. Myelolipomas. B. Malignant tumors. 1. Adrenocortical carcinoma (ACC), a rare but aggressive cancer affecting the adrenal cortex. 2. Pheochromocytomas, rare tumors that may secrete excessive adrenaline. 3. Neuroplastomas, more common in children, arising from immature nerve cells in the adrenal glands. Causes. The exact cause of adrenal cancer remain unclear, but potential factors include: 1. Genetic mutations, alteration in tumor suppressor genes, example TP53, or oncogenes. 2. Hereditary symptoms such as Lee-Promany syndrome, Beckwith-Weizmann syndrome, or multiple endocrine neoplasia, MEN syndromes. Risk factors: 1. Genetics, family history of hereditary syndrome. 2. Age, most common in children under 5 and adults in their 40s and 50s. 3. Gender, slightly more common in women than men. 4. Hormonal factors, conditions that increase hormonal stimulation of the adrenal glands. Complications: hormonal imbalance leads to 1. Causing syndrome, excess cortisol. 2. Hyperaldosteronism, excess aldosterone. 3. Virilization or feminization due to excess sex hormones. 4. Metastasis, spread to other organs, commonly the liver, lungs, bones. 5. Vascular invasion and thrombosis. Pathophysiology: adrenal cancers originate from the cortex or medulla of the adrenal gland. Genetic mutations disrupt normal cell cycle regulation, leading to uncontrolled cellular proliferation. Hormonal dysregulation often occurs, contributing to clinical symptoms such as hypertension, weight gain, or virilization. Pathophysiology of adrenal cancer, step-by-step process. Adrenal cancer, specifically adrenocortical carcinoma (ACC), disturbs the normal functioning of the adrenal glands due to abnormal cellular growth. Below is the step-by-step process explaining the pathophysiology. First step: genetic mutations and cellular dysregulation. Initiation: key mutations, TP53 mutations, IGF2 overexpression. Results: cells in the adrenal cortex begins to multiply uncontrollably, forming a mass or tumor. 2. Tumor formation, hyperplasia to neoplasia. Angiogenesis, loss of differentiation. 3. Hormonal overproduction, dysregulated steroidogenesis. The tumor cells often retain the capacity to produce adrenal hormones. Leading to excessive secretion of cortisol, causes Cushing's syndrome, hyperglycemia, hypertension, muscle weakness. Aldosterone leads to hyperaldosteronism, hypertension, and hypocalcemia. Adrenogens, estrogens, causes fertilization or feminization depending on the hormone predominance. Results: clinical symptoms arise based on the specific hormones overproduced. For tumor growth and local inversion mass effects, the growing tumor compresses adjacent tissues, causing abdominal pain or fullness. Capsular inversion. 5. Metastasis. Hematogenous spread. Tumor cells enter the bloodstream and spread to distant organs like liver, lungs, bones. Lymphatic spread. Tumor cells also disseminate via lymphatic system. 6. Systemic effects. Electrolyte imbalances, hypermetabolic state, excess hormones can lead to weight loss, muscle wasting, and fatigue. Immunosuppression. 7. Advanced disease progression. Cachexia, significant weight loss, muscle atrophy, organ failure, extensive metastasis, can lead to liver, lungs, or kidney failure. Understanding these steps is essential for targeted treatment and managing the complications of adrenal cancer. Signs and symptoms. A. Hormonal overproduction symptoms: causing syndrome, rapid weight gain, muscle weakness, purple stare, hypertension, and diabetes. Hyperaldosteronism, high blood pressure, low potassium levels, muscle cramps. Androgen estrogen imbalance, masculinization in women or feminization in men. B. Tumor related symptoms: abdominal pain or fullness to weight loss. 3. Palpable abdominal mass. C. Non-specific symptoms: 1. Fatigue, 2. Nausea and vomiting. Diagnosis: 1. Imaging studies, CT scan or MRI, identify the size, shape, and extent of the tumor. PET scan, detect metastatic spread. 2. Hormonal testing, serum and urine cortisol aldosterone, androgen, and catecholamine levels. 3. Biopsy, fine needle aspiration, FNA, or core biopsy, though rarely performed due to the risk of tumor spread. 4. Genetic testing, evaluate to hereditary syndrome linked to adrenal cancer. Nursing diagnosis. 1. Risk for fluid volume imbalance related to hormonal dysregulation. 2. Anxiety related to diagnosis and prognosis. 3. Impaired physical mobility due to muscle weakness. 4. Knowledge deficit regarding disease and management. Management. First, medical management. 1. Surgery, adrenalectomy, complete removal of the affected adrenal gland is the primary treatment. 2. Medications. Mitotan specifically targets adrenal cancer cells. Corticosteroids to manage hormonal deficiency post surgery. 3. Radiation therapy used to localize tumor control or palliative care. 4. Chemotherapy, agents like etoposide, doxorubicin, and caspulatin for advanced stages. The nursing management. 1. Monitor vital signs, particularly blood pressure and heart rate. 2. Educate patients about medications adherence and manage side effects. 3. Provide psychological support and referrals for counseling. 4. Monitor for complications such as infection, electrolyte imbalance, or adrenal insufficiency. Treatment options. 1. Early stage surgical removal followed by monitoring. 2. Advanced stages, combination of surgery, mitotan, chemotherapy, and radiation. 3. Supportive therapy, managing symptoms like pain, nausea, or hormonal imbalances. Psychosocial medicine. 1. Address emotional and psychological distress due to cancer diagnosis. 2. Provide support groups for patients and caregivers. 3. Help patients cope with body image changes due to hormonal effects or surgical scars. Prevention. 1. Regular screening for individuals with hereditary syndromes. 2. Healthy lifestyle practices including a balanced diet and regular exercise. 3. Awareness of symptoms for early detection. In conclusion, adrenal cancer is a rare but serious condition requiring prompt diagnosis and multidisciplinary treatment approach. Early detection and advancements in medical therapy have improved outcomes. Comprehensive care including psychosocial support, enhances quality of life for affected individuals. Thank you. Have a nice day.